Case study 3-1, displaced fracture of the femoral neck. While walking home from the train station, MA, a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. MA was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 3-2, introchanteric fracture. AR, age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intracrotonic fracture. Intraoperatively, Mr. R was given a spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secure in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His post-operative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in the legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and had assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Replacement of half the joint component is internal fixation. Substances that act against microorganisms are antibiotics. In a position away from the midline of the body is abduction. In a position toward the midline of the body is adducted. The prefix is dis, and away from, back, or again, a, without, an, not, ortho, erect, x, out, by, to, not, and the blanks are an adjective from the operative time span from decision for surgery to placement on the operating room table is preoperative. The adjective for the operative time span from placement on the operating room table until transfer to post-anesthesia recovery is called intraoperative, and the adjective for the operative time span from admission to post-anesthesia is post-operative.